Good morning, and thank you for having me. And thank you, Stephen, for inviting me. I can't believe it's been 20 years. Actually, it's been 20, we're in our 24th year in business. And I say our because my partner, who's also my mom and my look-alike, many people walked in this morning and said, hi, Pam. But I'm Kim, I'm her daughter. And we started Pegasus in 1994. And you know, one of the things people ask is, how did you get into that business? And I say, well, my mom was a nurse, or actually still is a nurse, and she had worked in hospitals and in administration, and then she found home care, and she loved it so much that she thought, this is the business that we need to start together, because we'd always wanted to start a business together. Now, I am not a nurse, but one of the things that influenced me to get into this caring business was really my grandparents and my mom. I grew up around the idea of taking care of our family was the most important thing you could do. And I was thinking about my grandfather this morning on my dad's side, because that was the last time that I got up this early in the morning on a regular basis, was to go and help him out at his restaurant. He owned the Lucky Boy on Walnut in Pasadena. And that was in the 70s, and I would spend a lot of my spring break and summer vacation with my grandparents, because my mom was a single mom raising us, working in the hospital. She didn't, really get vacation pay. Getting up early in the morning with Grandpa was one of the most fun things to do. Get up early in the morning and make breakfast for people that came in the store. And it was also a vocabulary lesson. I remember him saying to me, Kimberly, don't forget to put the cilantro in the taco. And I would say, cilantro, okay? And he would say, it's very perishable. Pop, what is perishable? So there were a lot of life lessons learned, a lot of education, how to make change, but also how to take care of customers. How to take care of customers and how to take care of employees. My grandfather, back in those days, they didn't have the online check for status, so he hired whoever came through his door. And he hired a lot of new immigrants to this country, some of them very poor. Some of them he let, sleep in the store if they didn't have a place to go when they were still getting started. Sometimes when he got a new station wagon, he'd give the old one to an employee. And then there was my other grandfather on my mom's side who owned a shoe store in El Sereno. And so he also taught me about taking care of people. He would have families that would come in and need shoes for all of their kids. And they couldn't oftentimes afford all of the shoes. And he would give them the shoes and say, pay me when you have the money. Much to the chagrin of my grandmother, who would say, what are you doing? So I also had a great grandmother. My parents divorced, but my mom taught me the importance of still visiting the great grandmother on my dad's side. She was in a place in the valley called the Jewish Home for the Aging, and my mom would, on her day off on a Sunday, say, let's go visit Grandma Bessie. So when I was in junior high school, I realized, wow, this place is right across the street from my junior high school. And after school, coming home, the latchkey kid with not much to do, I thought, why don't I just go hang out with Grandma Bessie? And so I started volunteering at the nursing home. So that's just a little bit about my background and how this caring, the idea of taking care of our family, taking care of our seniors, and taking care of employees really helped shape and get me to the point where I am today. And being in a room of caring individuals like yourselves, I know you can all relate to that. So now on to my subject for today. My goal of this talk is just to kind of give you information about in-home care services. What Pegasus does is we don't have a facility. Everything we do, we provide for our clients in the privacy of their own homes, or if some of our clients have chosen to live in an assisted living facility, we can also care for them there. So that's why we have your home, your life, your choice. There are a lot of times when we get to a point in life and we need to make a decision and we thought, oh my gosh, what do we do? And when you're at that point, it can be overwhelming. You might be in the hospital taking care of one of your loved ones, or you might have had an unexpected need for care, and at that point, we're our most vulnerable. So I'd like to give you some information about the main difference between home health care and home care. That's a really subtle difference in topic. Home care, home health care. Does anybody know what the difference is?
One would be for your health,
Yes.
and the other is taking care of the day-to-day home.
Perfect. Perfect. Our industry has struggled for a long time to define that because it's such a subtle difference. And I mean, home care, I mean, you could be thinking maybe I'm contacting a roofer or a, handyman. But that's the main differences. This slide still has my mom's name on it, but she said, I was a nurse, I got up early for many years to be at the hospital, and she said, I'm too old for that, you're on your own today. So it's just me today. And a little bit about us, I think I told you we started in 1994. We are licensed by the state of California, and we're also Medicare certified, which means if you have Medicare, we got you covered. We're also accredited by the Joint Commission, and we're contracted with a large network of insurance companies. So on the home health side, this is good. If you need home health care and you have insurance or you have Medicare, it's covered. With insurance, sometimes there's a copay, but with Medicare, it pays for in-home health care 100%. We serve LA and Ventura counties. We're based here in Glendale. Our office is on Maryland Avenue, but we serve the San Fernando Valley, San Gabriel Valley, Santa Clarita, the West Side. And we have about 100 employees. Not all of them full-time, but we do have about 100 employees because we're serving about 400 patients at any given time. We receive about 60 new patient referrals a week on the home health side. So it's like air traffic control in our office, people needing care, different types of care in all different places. So we have we're fortunate to have a strong tie in the community since we were established in the 90s, and the hospitals know us as well. So how do we do this? We need to collaborate. Like I said, it's air traffic control. We're collaborating with your doctor to get the orders. We're relaying this information. We're getting the history and physical from the hospital, their insurance company, and we're coordinating with all of our staff. You might be getting a nurse come to see you as well as a physical therapist. And because of regulation, we have to have them go out in a certain order. And we want to make sure that everything that we get from the home health side has a physician's order. And we also have the personal care you can forward. Thank you for forwarding. This is a quote from my mom. I told you a little about my background and what inspired me, but she just said this was a beautiful concept, the opportunity to care for people while keeping them in their homes. I knew this is what I wanted to do. What could be better? The opportunity to truly make a difference, to facilitate families being able to care for their loved ones with dignity, comfort, and the highest quality care, all in the comfort of their home. So some of the trends in our industry that are shaping the way we provide care is that the government has noticed, CMS, that's the Centers for Medicare, that home health care is very cost effective and that people generally do better when they're recovering at home. So when we first started, again, 20 years ago, 23 years ago, people would say, oh, so you have a facility, and we'd say, no, it's in your home. But nowadays, most people know about home health care because it's become such an essential part in treating you after you go home from the hospital. You're no longer staying in the hospital for a week. You're lucky if you're there 3 days. And so, again, they know that the patients do better. So this saves money in the long run. And people are more aware that they have a choice. Before I think you used to say, well, whatever my doctor does or whatever happens to me, and now you're given a choice. So thank you. So succinctly describe the difference between home health care, but I'll just repeat. The home health care is a higher level of medical care that is deemed medically necessary by a physician. And it addresses the medical needs such as wound care. We often have patients with diabetes who have wounds, or they might have a wound from an incision, surgical site. We have patients that go home with IV hydration, IV antibiotics. Sometimes they've just had bypass, or sometimes they just were hospitalized for an exacerbation of a chronic condition. And we follow them home to make sure they understand a new medication regimen, to make sure they are maintaining their diet. And we provide physical therapy. A lot of times patients atrophy very quickly, and so they might just need a little bit of like getting a private trainer at home. And then we have the patients that have the joint replacement surgeries. Those, of course, they need in-home therapy just for a little while. The goal is to get you to outpatient, but having that in-home therapy can be really a convenience, and you're more likely to do it if you don't have to get in your car and go look for it. So the people that work on our home health side are licensed nurses, the physical therapists. We have occupational therapy. We have speech therapy. And we even have medical social workers. So again, home health care, we do need a physician prescription. If your doctor hasn't sent it to us, but you think you might need home health care, sometimes patients call us and we'll say, okay, that sounds reasonable. Let us call your doctor and see if you qualify. We need a qualifying diagnosis. And of course, you have to be homebound, which means it doesn't mean that you never leave the home, but it means that you have great difficulty leaving the home, and that you might need the help of another person to leave home, or maybe it's just not safe for you to leave home. And that all helps define Medicare's definition of homebound. I talked about the payers. And our goal with home health care, Medicare doesn't pay for it to go on forever and ever. Our goal, they want us to help you rehabilitate, or even if a person can't, make 100% recovery, what is the 100% potential for you to recover? We want to get you to be the best that you can be and help you be safe at home, or get you in a place where you are ready to go for outpatient services. And then the home care, again, it's not a handyman, it's the personal care. And these are the other names that people call it, because we've had such an identity problem with this name home care. So people will call it personal care, respite care, attendant care, private duty. Private duty just means because you're paying for it. Companion care, and homemaker services. We chose to call ours Pegasus Personal Care. We were struggling. What do we call this? But I like the name Pegasus Personal Care because that's what we're doing. We're providing care that, how do you want it done? It's based on your personal preferences. You determine the schedule. You determine what you need. Sometimes people just need a companion. Sometimes people say, my dad won't eat unless somebody comes and cooks for him. Or, my mom needs help and she needs us to help walk her dog too. Because maybe it's not safe for them to just, maybe the dog is difficult to handle. Whatever their needs are, we can do the medication reminders. Now, a caregiver can't, they're not supposed to open up your pill bottles and say, oh, here, you're supposed to take one of these, two of these. That really should be done by a nurse because that's considered like dispensing or dosing. But if a family member or a nurse sets up a pill box, the caregiver is there to remind the person when it's time to take their medication, and maybe remind them, you need to take this with a full glass of water, or let's make sure you don't have this on an empty stomach. And again, the duration is totally determined by you. And at some point, most of us are going to need in-home health care. So, so they got dimmer here, right?
No, they didn't.
They didn't? Some of you, is there anybody in this room that's ever had in-home health care for themselves? Yeah? Because it's not always, you're not necessarily an elderly person when you need in-home health care. We have a lot of patients who are in their 50s and 60s who had joint replacement surgery, and just maybe that for that first few days you might need it. And it's your doctors are ordering it more and more because they just want to make sure you're safe. So even if you have the medical side, it worked out well for you. So even if you have the medical need, again, that can be short or longer in duration. You're up. So again, it's primarily determined on your need. A lot of times people will say, well, how many times is my nurse going to visit me this week? And for how long will the physical therapist come? And this is sometimes depending on your insurance. We have a lot of patients who, even though they have Medicare, they opted to assign their Medicare benefits to an HMO like a Kaiser or Healthcare Partners. And so those cases are a little different. They might say, go out one time and do an evaluation, and then send us your notes and we'll see what we'll authorize. And they tend to, our patients who have those HMOs, they do tend to get fewer visits. We have to really do a lot to justify the duration of care. And that's not to say HMOs are bad. We know that you can save money. And some of them are actually very good, like Kaiser, because they really care for the whole person and they're looking at all the psychosocial needs. And then, we also have to talk with the doctor. Patients will say, well, my doctor wants you to keep going. He says you should keep going, but we always have to answer to Medicare. So we do our best to really coordinate with the doctors, with Medicare, with our clinicians to get you as much care as you're entitled to. I think I mentioned already, there are no co-payments under Medicare. With the HMOs, we do see that patients have a copay per visit. Sometimes it's $10, sometimes it's $20. If you need IV services at home, these ancillary items may also be a cost to you individually. Your doctor might have ordered some IV antibiotics and the pharmacy says, well, you have a copay on the medication, just like any other medication. Even though we're administering it, it's still through a pharmacy. You can forward. And then how soon after you get out of the hospital should the services begin? We're supposed to be out there within 24 to 48 hours. It can be delayed if you say it's delayed. We'll call the patient and say, your doctor ordered us to come out there, and we'd like to come see you tomorrow. And the patient might say to us, tomorrow's not a good day. I'm going to have family here, or I'm just too tired from just getting home from the hospital. Please come a day later. So we can always accommodate that. And this is one of the most challenging things, is that we are supposed to call you before. And sometimes patients will call and say, nobody's contacted me yet. And we think, oh, thank goodness you called, because we got a phone number from the hospital, the insurance company, and it's not the right number. So if you're in the hospital, you have a loved one in the hospital, make sure that coordination is done ahead of time. I had a case just yesterday where a daughter-in-law said, nobody came to see my dad. And our nurse said, I've been trying to call this patient all day, he didn't answer. We had the patient's cell phone number, who is, very deconditioned, not able to get to his phone. He's in his late 80s, and his daughter-in-law was waiting for our call, but we never got the daughter-in-law's number. So those are certain things that can delay care. We never want to delay care, because we don't want you to boomerang back to the hospital. Now, when you're in the hospital, it's really interesting. There's a lot of incentives out there, some good, some bad, for why people might steer you to a certain provider. Sometimes we have a lot of doctors that have worked with us for years and years and trust us, and they'll say, I only want my patients to go to Pegasus. But then you might get a case manager in the hospital or a social worker who says, oh, well, I like this other agency, I want to send the patient there. Well, Medicare and insurance companies have finally got wind of this. I mean, if you're an insurance company, you have to have a contract. So like Pegasus has contracts with the insurance providers. But for the Medicare patients, Medicare said, this isn't right. This patient steering, patient manipulating. We want to make sure our patients know that they have a choice. So we've slowly seen this start to change in the last 5 years or so. And in fact, at Huntington Hospital, what I'm told they're doing now is they're giving patients an iPad, and they're letting them search home health providers from this iPad, and you can see their brochures and you can see their ratings. And my first question was, well, how do they clean that iPad? Ew, gross, you know? I was like, it's going from room to room, infection control. You know, so they assured me that it's got antibacterial and microbial, and they clean it in between, and I'm like, okay. But I think that, you know, their intention is good, and we'll see how it goes. They're starting to offer patients a choice, and in some hospitals they'll just give you a paper list. You know, well, here's a list of providers in our area that are good and that we work with. UCLA has their own proprietary system they use, and patients again can view us online, and you know they send us pings. I probably have about 10 of them on my phone right now. They send us emails and pings, and it says, we have a patient, and they send the face sheet, they send where the patient lives and what the needs are. Can you provide service for this patient? So I respond yes, and probably about 10 or 15 other companies respond yes, and then they show this to the patient. All of these companies have capacity for you, they all accept your insurance, and which one do you want? So this is a great thing on the home health side.
That'd be really overwhelming.
It can be overwhelming. It can be. You know, I mean, it's nice to sort of know who's out there beforehand, but not everybody, you know, has the ability to come here to a talk like this, or to, you know, do their research before they find themselves in like, oh my gosh, mom fell, you know, what do we do? So, and online, you know, online can be challenging. It's hard to know who the good providers are. I mean, I say check reviews, and we're, you know, really fortunate to have good reviews. But you know how it is with online reviews. Who reviews people? Who writes reviews? Unhappy people. Thank God no one has done that to me yet, although I shouldn't jinx myself. So, you know, you can do your best to do your due diligence. You know, you want to ask certain questions like, well, number one, is the agency in my network, if you have insurance, or if you're not going through Medicare. You want to maybe look at their accrediting body. You know, most agencies nowadays have to be accredited, so this isn't as true as it used to be, but we are accredited by Joint Commission. You can check your online reviews, even though you have to be wise in reading the online reviews to sort of weed out, you know, what were legitimate complaints and what are the real compliments, because the fake positives can be bad too. Luckily, I don't have any fake ones either. But you know, you talk to your discharge planners. Like I said, sometimes they have their favorites, but generally speaking, the people in the hospital do have experience. And ask your friends and neighbors. You know, who do they have? You can find really great companies that are well run and well managed. But at the end of the day, it boils down to who are they sending you? You know, I have 100 employees. Maybe 2 out of those 100, you know, you're just not going to like them. Not because they're bad, but maybe you just, you know, it's not the right synergy or not the right fit. And having said that, if you ever have a complaint, if you're getting service from a company and you don't like a certain provider, say, you know, this physical therapist I really didn't care for, let them know. They will happily reassign that person. I know with my own grandmother, I still have one grandmother alive, she's 96. She's tough. She's tough to please, but you know, I'm happy to accommodate anybody that's unhappy, especially when they're in your home. We want you to be comfortable. And then really important is, how does the agency respond after hours and on weekends? That is so key, because you know, oftentimes you're going to have a question or a need. Oh, I see the hook. It's a meaty subject. Let's see what else is on the slides. How much time do I? Oh, it's 8:30. I think I've said most of what's on the slides. I think I have. Can I ask if there are questions?
Absolutely.
Anybody have a question?
We're all, like you said, it's meaty. It's like a lot to take.
There's a lot to chew on. I always think, what am I going to say for 30 minutes? But
And you have some brochures? Or
I have brochures, and you know what? I can also put some business cards there, and please feel free to email me any questions. Even on a related topic, I'll just say, when it comes to nursing homes, anything to do with care, I kind of know the providers, and I always say free advice. you know, like Lucy on the peanuts, except not even 5 cents, free, you know. Thank you again. Thank you so much.